what are hormones and how does it help the functioning of the body?
Hormones are basically chemical messengers that are secreted by a few of the specialized organs in our body, which we call as endocrine organs.
What is hormonal imbalance? How does that occur and how does it affect our body?
Now, any imbalance, either deficiency or excess, can disturb this balance, which can lead to different diseases, including cancer. So we see more and more women in urban population having habits like smoking, alcohol, sedentary lifestyle. All of these will lead to excessive estrogen and progesterone in the body.
Welcome to OncoFlix. Today we are going to talk about hormones, the silent puppeteers of biology. They can make or break the body. Today we are going to talk with Dr. Roshni Dasgupta, medical oncologist at HCG Hospitals, who's going to enlighten us with hormones and its link to cancer. Welcome to our show, Dr. Roshni.
Thank you, Dr. Lohit. Thank you, Dr. Kritika.
Welcome, Dr. Roshni.
So, what are hormones and how does it help the functioning of the body?
Hormones are basically chemical messengers that are secreted by a few of the specialized organs in our body, which we call as endocrine organs. And they affect the different organs, their target organs, by controlling metabolism, cell growth, sensitivity to other hormones. And that is how it can regulate how our body responds to different stressors, including internal as well as external.
That's good to know. So, what is hormonal imbalance? How does that occur and how does it affect our body?
The body always stays in a state of equilibrium. So hormones are essential for different processes in the body, be it at a very cellular level, like metabolism of simple glucose, to what you can see externally as diabetes or obesity. Now, any imbalance, either deficiency or excess, can disturb this balance, which can lead to different diseases, including cancer.
So, when you talk about cancer and hormones, how does this hormone imbalances lead to cancer development?
So I think I'll cite an example at this point of time. And the one that comes to my mind right now is about insulin.
Okay.
So often we know that diabetes, which is associated with insulin resistance, different type of diabetes are there, but the one that is associated with insulin resistance leads to a more inflammatory state in the body, which can lead to unchecked cellular growth and hence cancer. It leads to obesity, again a state of inflammation, which is often leads to hormonal imbalances in females, like estrogen and progesterone imbalances, which can lead to secondary cancers like breast, ovary, endometrium. Another such example is, say, cortisol. Cortisol causes decreased immunity in the body. So often cancer cells that generally develop in our body and are removed by our immune cells are often led to development of other cancers because they're unchecked. So there are different such hormones. There are thyroid hormones controlling metabolism. All these can ultimately imbalances in such hormones can lead to development of cancer.
So, whenever cancer occurs, there goes this question: what caused this? So, if we have to ask the same question to hormonal imbalance also, what kind of cancers are commonly associated or caused because of hormonal imbalance?
As I mentioned, there are estrogen and progesterone, say the female hormones. These imbalances in such hormones can lead to breast cancer, ovarian, endometrial cancers. Similarly, in males, often prostate cancer, it is one of those cancers wherein testosterone leads to cellular overgrowth.
So, I mean, we stay in the urban scenario, like for example, a city like Bangalore. The most commonest female cancer is breast. How does estrogen and progesterone influence cancer causation? Is it again linked to genomics? How does it manipulate and play a role in cancer causation?
There are types of breast cancer. There is one particular subtype which is fueled by excess estrogen or progesterone. And when I say excess estrogen and progesterone, one of the words that you use is urban women population.
Correct.
It is often associated with lifestyle.
Mhm.
So we see more and more women in urban population having habits like smoking, alcohol,
Mhm.
sedentary lifestyle.
Mhm.
Often they are obese. All of these will lead to excessive estrogen and progesterone in the
Mhm.
body. And apart from lifestyle and environmental factors, there is also natural physiological causes
Okay.
like early menarche, late menopause. Basically, the increased duration of more and more
Exposure to
estrogen
estrogen.
formation can lead to breast cancer.
There has been a lot of report of late with respect to milk and exogenous estrogens and even poultry farms. Either they graze through these feeds which are rich in estrogen, or they've been injected with these things to increase the yield, and that being associated with a lot of early menarche, and indirectly that again increases the risk of estrogen exposure and breast cancers. So what is your take on that?
I think it's a very valid point, and I have kind of an example to give you very close to me in my family itself. So nowadays, simple meat like simple poultry, chicken,
Correct.
they are often infused with not just antibiotics, which is quite well known now, but often hormones to increase the muscle of these animals. Now, often children they actually start developing breast buds.
Yeah.
Oh.
Children, small children who have not attended their puberty, and I have seen this.
Oh.
So we had to change the meals, and it would go away.
Okay.
Yeah. So yes, environmental factors is very important, and exposure to these kind of hormones through different food is a concern at this point of time.
I think that's absolutely important. Moving to men's health, testosterone plays a very important role in men's health, but we also know that testosterone is also one of the main factors for causation of prostate cancer in men over 60 years of age. How is this testosterone implicated in causation of prostate cancer?
I think I'll reword it. It's testosterone would cause a prostate cancer is probably, I'll reword it in this form that the prostate cancer cells are more sensitive to testosterone. Hence, for men who do develop prostate cancers, it is imperative to reduce the body testosterone level through different medicines.
We often see prostate cancer develop in elderly age and not at a younger age. Um, could we say testosterone to prostate cancer is equal to estrogen in breast cancer?
So you can very naturally see physiologically with aging, actually testosterone levels go down.
Yes, yes.
Mhm.
Yeah, but it is more of senescence that is associated with
Right.
prostatic growth. Even BPH and all, which is also associated with testosterone, all is an aging factor
Correct.
rather than exactly a testosterone factor.
Right. So we also see that in present generation there is a lot of thyroid hormone issues. It's become a every house issue kind. At least there is one person with thyroid imbalance. So how does this thyroid imbalance affect development of thyroid cancer and other cancers also? Because we know thyroid hormones control a lot of other hormones. So how does this impact?
Yes, thyroid is one of the most important hormone that is associated with different kind of metabolism in the body. Especially the one that you mentioned, we generally don't see hyper over functioning of thyroid, but rather hypo, that is under functioning of thyroid. And this is something that has been associated with development of thyroid cancers. Not only that, peripherally. Now, secondarily, what happens when it reduces the body metabolism is patient develops effects which are associated with insulin resistance, obesity, again going back to the same loop of
Correct.
inflammation and development of cancers in other organs. So, yeah, there is a lot of evidence coming up where thyroid is associated not only with thyroid cancers but other cancers like liver.
Right. That's
So
interesting.
what is, I mean, you spoke about insulin resistance. So what is insulin and how does it act as a growth factor to cancer cells? And is it only like pertinent to pancreatic cancer because insulin is secreted from the beta cells of the pancreas? Or is it also implicated in causation of all other cancers? And could it also be an important growth factor for patients who have already had cancer or undergoing treatment of cancer? Does it probably help in progression of disease or in metastasis of disease? And the outcome of disease can be altered if at all there is insulin resistance or increase in insulin.
A very good question. Basically, insulin is associated with glucose metabolism. Now, the culprit is not insulin, the culprit is glucose. And any imbalances in the insulin levels lead to hyperglycemia. This is increased glucose in the body, and glucose becomes a fuel for cancer cell growth. And now you know, even in the CG, Dr. Kritika and yourself are, we are associated with the project which is showing different results that decreasing carbohydrate and glucose level can actually arrest cancer cell growth. So, and there is more and more evidences coming from globally as well. So, glucose metabolism is what is related to cancer uh, development as well as metastasis.
What about cortisol, the stress hormone? How is it influencing both cancer development and outcomes?
I would say that the effect one is direct and another is indirect. Direct effect of cortisol is again decreased immunity. Hence, cancer cells that do develop might remain in the body because of non-removal by the immune cells, leading to development of cancer. Cortisol indirectly causes insulin resistance, which can, again, as we discussed in our previous question, that can lead to further cancer development. Hypercortisolemia, stress, diet, a lot of such factors related to lifestyle and environment can lead to hypercortisolemia, which can ultimately culminate into development of cancer.
So it's a negative player, both with respect
Yes.
to causation and outcome.
Yes, it's a very important hormone, again related to metabolism. But what we are trying to emphasize is the imbalance which leads to development of cancer. So yes, hypercortisolemia is associated with cancer development and
Yeah, so I've always had this question, and we use DEXA, which is a steroid, commonly for many cancer treatments, importantly chemotherapy and some areas of radiation also. So, does that cause to increased cortisol levels? Does that affect?
Yeah, very good question. Sometimes it becomes important as a measure to use steroids. Sometimes patients develop cancer associated edema, that is fluid collection around those cancer cells. And if it happens in certain vital organs like the brain, it becomes a life-saving measure to give steroids to decrease that edema as rapidly as possible.
Right.
But also when we do use steroids, we do know we want to limit the dose and the duration of the steroid also, for the exact reason that we discussed, that cortisol, high level of steroids can ultimately lead to immune suppression and cancer.
You spoke about lifestyle factors and environmental factors which could influence, especially the hormone driven cancers. What are the most significant environmental and lifestyle factors which you feel in your clinical practice is more pertinent to causation of hormone driven cancer? Because you're an expert in breast cancer specifically.
Lifestyle related factors are sedentary lifestyle, stress. However, it is related to be it personal or professional stimulus, habits like alcohol.
And in your clinic, what are the reliable tests which you would recommend to our viewers to undergo to detect these hormonal imbalances?
We can directly measure some of the hormone levels in the blood, like thyroid. We can do insulin growth factors, estrogen, progesterone, testosterone. These are the hormones which can directly be measured in the blood. Apart from that, there are other hormones like cortisol, which has to be tested during a specific time of the day.
Does managing the hormonal imbalance has an effect on the treatment and outcome?
Yes, absolutely. Hormone imbalance is well controlled. In general, as I said, healthy lifestyle, ability to decrease glucose intake in food and achieve an equilibrium in glucose metabolism, reducing weight. These are all essential to decrease certain hormones like estrogen and progesterone in the body, which is an essential part of the treatment of a certain breast cancer, ovarian cancer, and endometrial cancer. So these are direct effects of where in if hormonal imbalances are controlled, we can actually as a part of treatment inculcated in cancer treatment.
And that's like cutting the root cause itself.
Yeah, yeah. It can prevent recurrences. It can prevent further growth of cancer and spread of cancer.
So, do you have different treatment strategies for hormone-related cancers compared to non-hormone related cancers? And what are the current therapies you advocate?
Yes, they are treated a bit differently. Um, Hormone sensitive tumors, like that of breast, endometrial, we often use anti-estrogen, anti-progesterone therapies. They are quite well known now. Whereas hormone non-sensitive tumors are treated quite differently.
The outcomes of hormone-related cancers are better than the non-hormone related cancers.
The answer would be different for different tumors, but if I would want to think about only breast cancer, the hormone sensitive one, ERBR positive but negative, is biologically considered to be one of the more indolent ones that is the other subtypes of cancer. But having said that, this is one of those subtypes again, which when treated at an early stage, they tend to recur much later. Again, emphasizing on the point that it is important to have a hormonal balance between pregnancies.
But what about these natural supplements? People talk a lot about turmeric or some flowers which could have this anti-inflammatory activity, an evening primrose oil, and all that. So, what is the role of those natural remedies in maintaining hormonal level?
So there is some literature behind this, like the ones that I am aware of, that they have talked about supplements like ashwagandha or omega-3 fatty acids, which can help in managing hormonal balances in the body. But I believe the literature is yet to develop more and more before we can use them in general for all our patients. Right?
So, how does the diet and lifestyle modification make an impact in probably reducing the risk of cancer and probably by controlling the hormonal or maintaining the hormonal balance?
Maintaining a balanced diet, exercising regularly, ultimately leads to more balanced hormonal levels in the body. It decreases estrogen level, which is by now we know associated with. Yeah, I think that is why that's.
What is your take on milk and poultry products? Now that we know a lot of evidence on that, should someone stop taking milk and milk products at all?
Yeah, I think this is very difficult to manage at a personal level. You can't really stop, but there are benefits also.
Yes, absolutely.
So this is something that has to be taken up at a more administrative level, where proper food control and development, use of different pesticides, and these are more checked in a more strict way. So it's very difficult to say at a personal level that don't give milk.
Yeah,
Exactly.
yeah. We often hear patients saying that we got to know that this could be the source, so we have cut that off. But more often you find that that could have been a major nutrient source for them, and they don't have a proper replacement for that nutrient source also.
So, what is the latest or probably the emerging research which is happening with respect to cancer or something very exciting in your whole field of expertise?
The ones that I can recall at this point of time, there is a lot of research going on which is related to the microbiome. There are certain epigenetic related research that are going on.
So if you have to give one advice to our viewers to reduce the risk of hormone related cancers for female and male, what would that be?
For both of them, I think the first thing that we would advise, we would recommend is to maintain a healthy lifestyle, maintain a balanced diet, vegetables, fibers, these are important. Managing stress
And obesity also.
obesity, absolutely.
Perfect. Thanks, Dr. Roshni, for your wonderful insights. It's been a pleasure having you.
Yeah,
Thanks for
my
taking this
pleasure to be a part of this awareness. Thank
Thank
you for inviting me.
Thank you.